Frown lines form when facial expressions are made as the muscle under the skin contracts. Over time, as your skin ages, these repeated expressions cause lasting frown lines. Neurotoxins such as Xeomin or Botox are prescription medications that block the release of chemicals that cause these muscle contractions, so frown lines are softened.
Indication: Xeomin, or Botulism toxin A, is a prescription medicine that is injected into muscles and used to temporarily improve the look of moderate to severe frown lines between the eyebrows, or glabellar lines, in adults. Important safety information: Xeomin, or Botulism toxin A, may cause serious side effects that can be life-threatening. Call your doctor or get medical help right away if you have any of these problems anytime, hours to weeks after treatment with Xeomin. Problems with swallowing, speaking, or breathing can happen after an injection of Xeomin if the muscles that you use to breathe and swallow become weak. If these problems are severe, you could die. People with certain breathing problems may need to use muscles in their neck to help them breathe, and may be at greater risk for serious breathing problems with Xeomin. Swallowing problems may last for several months, and during that time you may need a feeding tube to receive food and water. If swallowing problems are severe, food or liquids may go into your lungs. People who already have swallowing or breathing problems before receiving Xeomin have the highest risk of getting these problems. Spread of toxin effects. In some cases, the effect of botulism toxin may affect areas of the body away from the injection site and cause symptoms of a serious condition called botulism. The symptoms of botulism include loss of strength and muscle weakness all over the body, double vision, blurred vision, and drooping eyelids, hoarseness, or change or loss of voice, trouble saying words clearly, loss of bladder control, trouble breathing, trouble swallowing. Do not take Xeomin if you are allergic to Xeomin or any of the ingredients in Xeomin, had an allergic reaction to any other botulism toxin product, such as Botulism toxin B, Myoblock, Botulism toxin A, Botox, Botox Cosmetic, or Botulism toxin A Dysport. Have a skin infection at the planned injection site. Before you take Xeomin, tell your doctor about all your medical conditions, including if you have a disease that affects your muscles and nerves, such as amyotrophic lateral sclerosis, or ALS, or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects, including difficulty swallowing or breathing. Tell your doctor if you have had any side effect from any other botulism toxin in the past. Breathing problems such as asthma or emphysema, a history of swallowing problems or inhaling food or fluid into your lungs, aspiration, bleeding problems, drooping eyelids, plans to have surgery, had surgery on your face. Also tell your doctor if you are pregnant or plan to become pregnant. It is not known if Xeomin can harm your unborn baby, are breastfeeding or plan to breastfeed. It is not known if Xeomin passes into breast milk. Tell your doctor about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal products. Using Xeomin with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you have received Xeomin in the past. Especially tell your doctor if you have received any other botulism toxin product in the last 4 months or in the past. Be sure your doctor knows exactly which product you received. The dose of Xeomin may be different from other botulism toxin products that you have received. Tell your doctor if you have recently received an antibiotic by injection, take muscle relaxants, take an allergy or cold medicine, take a sleep medicine, take a blood thinner medicine. Xeomin may cause loss of strength or general muscle weakness, blurred vision, or drooping eyelids within hours to weeks of taking Xeomin. If this happens, do not drive a car, operate machinery, or do other dangerous activities. Xeomin may cause other serious side effects, including allergic reactions. Symptoms of an allergic reaction to Xeomin may include itching, rash, redness, swelling, wheezing, asthma symptoms, or dizziness or feeling faint. Tell your doctor or get medical help right away if you get wheezing or asthma symptoms, or if you get dizzy or faint. Other side effects of Xeomin include dry mouth, discomfort or pain at the injection site, tiredness, headache, neck pain, muscle weakness, and eye problems, including double vision, blurred vision, drooping eyelids, swelling of your eyelids, and dry eyes. Reduced blinking can also occur. Tell your doctor or get medical help right away if you have eye pain or irritation following treatment. Tell your doctor if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of Xeomin. For more information, ask your doctor or pharmacist. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see accompanying Xeomin full prescribing information and medication guide. Copyright 2014, Mertz North America Incorporated. Xeomin is a registered trademark of Mertz Pharma GmbH & Company, KGaA, patent pending. Botox, Dysport, and MyoBlock are registered trademarks of their respective owners. Consult an experienced physician to help you find the right treatment option for you.